One of the skills that you have to develop and takes a lot of practice is taking a really high quality diagnostic set of radiographic images. And you're going to spend a lot of quality time with Dexter while you're enrolled in school when you take radiology. And that's one of the main stressors of, of radiology. Dexter doesn't have any feelings. There's no gag reflex, there's no tongue, there's no mandibular tori. There's a lot of things missing with Dexter. But one of the great things about Dexter is that you can get your technique really solid when you're working on Dexter to really hone in on your skills of taking great radiographs. You are responsible for taking diagnostic radiographs so that the dentist can detect early decay and periodontal disease. And it is important for you to have the sensor in the right positioning and have the correct angulation of the PID so that you can take the right image to have early detection of those two dental diseases. This is your responsibility as a clinician, and diagnostic radiographs are part of the standard of care. So in this episode, we're going to talk all about sensor placement for each of those images and then some of the tips to improve those images because you're going to meet some of those challenges head on when you switch over from Dexter to your real live patient. So if that's something that interests you, then this is the episode for you. Hey, are you in dental hygiene school or just got your acceptance letter and just started dental hygiene school and you're worried about how you're going to fit it all in, what the evaluations are like, what the key strategies you need to set up in order to be successful? You don't want to have worked all this time to get accepted into dental hygiene school only to make some pretty major errors in your first and second semester. I've put together a course that will really help you set yourself straight right out of the gate and get yourself started on the right foot in dental hygiene school. Whether or not you're just entering school or you've done your prerequisites and you're just well on your way halfway through, this course is designed to help get you straight and keep you straight so that you can become a dental hygienist. Click the link in the show notes and check it out. Hey everyone, welcome to the Happy Flosser podcast. My name is Billy Lunt. I am your host, and I am here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. Welcome, so glad to have you. Let's talk about the sensor positioning for each of your images. When we are starting on the maxillary central incisors, you want to place the sensor right in the embrasure space between the two central incisors. And be sure the patient doesn't bite down on the cord when you place the sensor. It should be parallel to the lateral incisor, and the patient's mandible should be parallel to the floor. So make sure your patient's chin is not up too far or down too far. If you are taking a maxillary central / lateral incisor image, you want to make sure that the center of the sensor is in the embrasure space between the central and the lateral. And be sure the patient's not biting on the cord. The sensor should be parallel to that lateral incisor, and the patient's mandible should be parallel to the floor. When you are trying to get the maxillary canine position for an image, you want to place the sensor centered in the embrasure space between the canine and the first premolar, about an inch back from the lingual surface. Be sure the maxillary teeth are biting on the block. You have to place it about an inch back because of the curvature of the palate and the length of the root of the canine. The point of the canine can sometimes shift the sensor, so you want to make sure that you look through the rin and that you have it centered correctly. Remember, you're using the blue anterior rin, and the sensor is vertically placed for these anterior shots. When you're doing the mandibular central lateral incisor image, you want to place the sensor centered between the two mandibular central incisors. Move the tongue out of the way. You don't want to rest the sensor on the patient's tongue. The image should capture the centrals and the laterals, and sometimes you may get a section of the canine as well, but the central ray should be directed between the mandibular central incisors. For the mandibular canine image, you're still using the blue anterior rim. Place the sensor centered on the embrasure space between that canine and the first premolar. That central ray is positioned between the canine and the first premolar, right in that embrasure space, so that the sensor is vertical and you don't have the cord in the way. Make sure that your patient is not biting on it and that the canine is centered in the rim when you look through it. When you're taking the maxillary premolar position, you are using the yellow posterior rim and the sensor is in a horizontal position. You're going to place the sensor so that the central ray is positioned between the second premolar and the first molar. And what's challenging with this particular image is capturing the distal aspect of that maxillary canine. That can be really challenging. Have the patient bite down gently so that you can move that image as you need to and try to get the position of the sensor in the right spot. You may need to place the sensor further in towards the middle of the palate. When you are doing the maxillary molar positioning for the image, you are using the yellow posterior rim and you're going to place the sensor parallel to the lingual surface. The central ray is centered on that second molar. If there's a third molar, you might want to try to move the central ray to the embrasure space between that second and third molar. Tilt the sensor slightly to capture those apices of the third molar. You may get some overlap here on the first and second molar, but the roots are typically tipped here, so you want to make that minor adjustment, keeping in mind that you may have to make an additional shot for the wisdom tooth there. Not a problem. If you anticipate and you always change as you go to make sure you get the apices of every single tooth in your complete set. When you are doing the mandibular premolar position, you are going to position the central ray at the embrasure space between the second premolar and the first molar. Again, you are positioning the sensor in a horizontal orientation and you are using the yellow posterior rim. You're going to seat the sensor on the floor of the mouth, not on the patient's tongue. Try to get the distal of the canine, which is not always possible depending on the shape of the patient's mouth, or if there's mandibular tori present. These present some challenges for you. The mandibular molar positioning for image is ideal to capture all the molars on the image. You want to place the sensor so that the central ray is centered on that mandibular second molar. And just like with the maxillary posterior image, if the third molar is present, line up that central ray on the embrasure space between the second and third molar. You may get some overlap as well, but you can make the necessary adjustments on the premolar shot if you need to. The most important thing is to capture the apices of all of the teeth. Now let's move on to the bite wings. Horizontal premolar bite wing position, you want to position the central ray between the embrasure space of the second premolar and the first molar. You are using the red rim for your horizontal premolar bite wing. Place the sensor as forward as you can to capture the distal of the canines. This can be pretty challenging. The front of the sensor is angled towards the opposite lateral. This allows you to open up the contact spaces between the teeth. If you're not able to capture the distal of the canine, the entire first premolar should be evident on your premolar bite wing. Your horizontal molar positioning for your posterior bite wing, you are again using the red ring. You want to position the central ray centered on the second molar and position the sensor to capture all of the molars. Everything should align parallel to avoid overlap. You should capture the distal aspect of the last molar. Now, with that being said, sometimes when all of the premolars are present and all of the molars are present, you may need to take 3 bite wings on each side if you are doing horizontal or vertical in order to achieve this goal, capturing the distal of the last molar and the distal of the canines. So keep that in mind when you go to take your posterior x-ray. If you do not capture the distal aspect of the very last tooth, that you may need to take a third one in that side, especially if there's a wisdom tooth present. You want to check each image as you take them so that you can make the necessary corrections. This is a really great habit to get into in order to avoid taking retakes. Sometimes if you take your premolar image and you are too far back, that may account for your molar image, and then you can retake your premolar image and be okay by moving forward. Sometimes when you take your molar image first, you may be too far forward, and that will be your premolar image, and that's okay too, as long as you make the necessary adjustments so that your next image captures the areas and anatomy that you missed on the first one. So you want to be really strategic as you work yourself through a full mouth series of x-rays. You will find that there are some challenges. What if my patient has really long roots? You will learn to adjust the vertical angulation by tipping the PID toward the crown in order to achieve an image of the roots of these teeth. A couple of additional tips. When you're taking vertical bite wings, the wire always goes towards the maxilla. For a premolar bite wing slot, angle the sensor toward that opposite lateral or canine, especially when a patient has a really narrow arch. This is going to ensure that you have that dreaded open contact that we all aspire to have between the first and second molar. Sometimes when we take our bite wings and we have overlap on that first and second molar, it's just a minor adjustment of moving that sensor so that it's pointed right towards the opposite arch lateral, and then you're good to go. It will open that contact right up. Because remember, that maxillary second molar occlusal table is rhomboidal in shape. So you have to accommodate for that shape in order to open up that image and open up that contact. Align the interproximal spaces perpendicular to the sensor. That's what I'm talking about. By doing that minor adjustment, it opens up that contact because your bite wing x-rays have to have open contacts in order for them to be diagnostic in nature. One of the other little tips that you can do is have the patient smile when you're looking through the rin. This will help you see the teeth and see which teeth will show up on the image. It's a really easy trick to do. Now, there are some other challenges that occur with patients that have tori or they have a sensitive gag reflex. Being confident in what you're doing goes a long way at helping you manage those patients. And patient management is something that just comes with experience and time. There are some things that you can do to be best prepared to see your patient that will help you manage the patient better. Offer those encouraging words and have a positive attitude towards your patient. Be calm and self-assured. You can also provide the patient with small breaks between your images and offer encouraging words as you go. Taking the sensor out of their mouth to allow them a moment to just breathe and rest will go a long way at showing your compassion and kindness towards your patient. And at the end of the day, when you take an image, regroup and think about it. Critique each image as you take it, and if you need to make adjustments or don't know exactly what adjustments you need to make in order to change course or achieve the goal that you're looking for, ask your faculty for help. Don't proceed forward and take unnecessary radiographs on your patient because there's nothing worse than exposing a patient to radiation unnecessarily. We don't like retakes, and neither do our patients. We want to be safe and effective in all that we do. So reach out to your faculty as you work with your patients so that you can get the guidance you need to make those adjustments in that moment to make a great. One last suggestion I'll just provide you is that we get highly skilled with practiced and continued evaluation. Self-evaluation of our radiographs throughout the entire process when we are taking these images is key. So I don't want you to overlook that fact. It is so important for you to continually be evaluating, self-evaluate each image that you take. Don't just trot along and continue taking those images on your patient. Look and see, do I need to change my angulation? Do I need to change my sensor placement? Do I need to make any kind of adjustments that will make it so that the next image I take is high quality? Don't give up on yourself, because radiology is one of those subject matters that as you practice and self-critique, you will get better, you will improve. And take the time as you're taking those, spending all that quality time with Dexter, to really hone in on your skills of angulation and adapting and making those self-reflective changes so that you can master that skill even quicker. Good luck. Are you looking for study sheets? I've created study sheets that cover the content of this episode. If you're interested, or that's something that's going to help you on your learning journey, you can click the link listed right in the description of these show notes. Happy studying! I would invite you to send me any questions that you need answered. Questions come up when you listen to this podcast. I have a link in the show notes, and I'd be happy to answer any questions that you have. Also, I would appreciate a review if you have time to leave one. Thank you so much.